Today's actually the second of a four-part series that we're hosting here at NCUIH, where we're focusing on strengthening vaccine confidence in Native communities. For today's session, we're going to be talking about media, communication, and outreach strategies. And so we're really excited to share a few things with you today around this topic. So I'll be your facilitator for today's meeting. My name is Alyssa Smith-Longi. I am Fort Peck, Assiniboine, and Sioux. I'm a program manager here at NCUIH. I'm based out of Washington State, and I'm also a registered nurse. I will go ahead and invite River to also introduce himself.
Hello, everybody. My name is River Carroll. I serve as the Policy and Communications Associate at NCUIH, and I'm happy to be here with you all today.
And then we're also really excited to be joined by Honey Rhonda from Urban Indian Center of Salt Lake. Actually, Honey Rhonda, if you wanted to introduce yourself as well really quickly, I think it makes more sense than just skipping over. And you're on mute.
I appreciate that. Thank you. Shikwasin to each and every one of you. Good morning, good afternoon, and wherever it is that you are, I just want to say hello to each and every one of you. She Rhonda Honey Duval Yimshe, Tkatnizani Nishle, Na Hitli Bashishchin, Mai Dishgishi da Shiche, and then Tkatnizani Nishle, Mai Dishgishni. Yeah, so in that sense, I'm just acknowledging myself as a Dine Nahitli individual. Normally, we have four clans that we acknowledge ourselves with. I just have three, and there's a reason for that. But I want to make sure that each and every one of you, my relatives that are out there, that we are acknowledging ourselves in the proper way. For those of you guys that maybe that didn't understand what I stated, my name is Rhonda Honey Duval. Here in Salt Lake City, Utah, I am a member of the Navajo Nation. I am also half African American, so I am just acknowledging myself as a Diné Nahitli individual, and I am honored to serve as the outreach manager here at the Urban Indian Center of Salt Lake City.
Thank you, Honey Rhonda, for that introduction. We're really excited to hear from you today. All right, so just a quick overview of what we're going to be covering. So we will touch on, I'm sure you've been hearing about this more and more with all the changes, but shared or individual-based decision-making. We're also going to talk about communication and outreach strategies, as I mentioned, and how we can strengthen vaccine promotion. And then we will hear from Honey Rhonda from Salt Lake on their UIO social media and outreach community promotion efforts. All right, and so I do want to start us off with a land acknowledgement. NCUIH acknowledges that our national office in DC and nearby activities are situated on the traditional homelands of many Native nations. Some of the communities in the surrounding area include the Piscataway, Pamunkey, Nantego, Mattaponi, Chickahominy, Monacan, and Powhatan peoples. These lands have deep historical, cultural, and spiritual significance to Native peoples. Just a quick background on NCUIH for those who aren't familiar with us. We are a national representative advocating for the 41 urban Indian organizations contracting with the Indian Health Service under the Indian Healthcare Improvement Act. So this community learning that we're hosting today is part of a bigger network that we have here at NCUIH called the Native Health Protection Network. If you're a part of it, welcome. We're really glad to have you here. If you haven't joined, you're still welcome to sign up. It's free. Essentially, we send quarterly newsletters like the one that we just sent here yesterday. They provide different information around immunization updates. We share resources. We remind you of upcoming trainings. And then we also host this community learning series. So feel free if you'd like to join. Like I said, it's free. You'll just get quarterly emails. I won't blow up your email box. But this is something that we wanted to make sure we shared with you all today. So we are hoping to engage with you all a little bit today using an interactive software called Mentimeter. And so just a quick overview of how that works. Liz will put in the chat a link that you can click on your desktop, and that should pull up the polling for you there. You're also welcome to use your mobile phone, and you can scan the QR code on the screen. Anytime a polling question comes up, the QR code will be on there, so you're able to scan it again if you happen to pull away. But this is just an anonymous way for you to interact with us. You can always use the chat box as well, but you can see what people are responding. So we will go ahead and start with a little icebreaker just to kind of test it out. And so the question that we have up here for you all today to start us off is share one word that describes what outreach looks like in your community. And so you should be able to scan also the code at the bottom. And this is a word cloud, so we'll kind of see what people are saying. So we see empowerment, complicated, decentralized, health, listening, integrity, fun, connection. Oh yeah, I love that one. Advocacy, health fairs. Now they're all coming up. Trust. Yes, trusted messenger is such an important part, especially when it comes to talking about things like vaccines. I might be missing some that come through. Collaboration, definitely. Siloed. Yeah, there's definitely challenges too when you're trying to outreach with your community. Consistency. Yes, I always tell people, especially when you're working with Native communities, you can't just reach out and then stop. Like you have to be consistent and show that you're showing up. So, well, feel free to keep putting stuff in there if you like. The word cloud will get bigger as it goes, so we'll be able to see it at the end. But we'll go ahead and move on to the next part. So I'm sure most of you in the room have already heard, but on January 5th, federal officials did announce that they were updating the U.S. childhood immunization schedule. And so these updates reduced the universally recommended immunization for children from 17 to 11. And so in response to this, the CDC has updated their vaccine schedule to be grouped into 3 separate groups. And so now what you'll see from their recommendations is immunizations recommended for all children, immunizations recommended for certain high-risk groups or populations, and then immunizations based on shared clinical decision-making. Something I just want to highlight in all of this, especially with that third group around certain high-risk groups or populations, some of the immunizations that were removed from universal and moved into that group, for example, like RSV, when you think about it for Native American children and infants, all Native American children and infants are considered high risk. And so that's something just to be aware of as you're thinking through these updates and seeing kind of like what comes down the pipeline from the CDC particularly. I did want to share as well. I know that it's very confusing when we constantly see these things changing. Some of the professional healthcare organizations, such as the American Academy of Pediatrics, have stated that they're going to continue to release their own recommendations as well, that they're evidence-based. And so as you're communicating with your community, or whether you're a provider who's prescribing or recommending these vaccines, you do have other options to look at or to refer families to if they're trying to kind of decide whether or not this is an immunization that they want to give to their child. And I do know as well to kind of check with your state, because some of the states have also stated that they're not going to comply with the federal recommendations, and they're going to use their own broader recommendations. So there's different options out there for you to consider and look at when you're thinking through these changes. Another resource or option that you can look at is through the American Academy of Family Physicians. They've also published an adult recommendation or schedule and a pediatric one as well. And then immunize.org is a really great resource who's been working to compile all of this information into one tool. And so that's what you'll see here on the left is where they'll have the CDC federal recommendations. I know for things, for some federal programs, you have to be complying with certain things. There's the states, and then they're also grouping in there the healthcare professional organizations. So that would be like the American Academy of Pediatrics. And so when we share the slides, you'll have the links to all of this on the slide deck, but definitely recommend looking at some of these to try and stay up to date with everything that's been going on. All right, and so a little bit on shared clinical decision-making. Like I said, that's now that third category that we're seeing in terms of the CDC recommended vaccines and immunizations. And so just to kind of give you like a brief what this is, basically it's decision making that happens as a conversation between the patient and the healthcare professional. Yes, this is being talked about in terms of vaccines, but this could also be used in terms of how you inform treatment plans. Something that's important to remember is that this is not a new practice among providers. We've been engaging in these practices for a long time. Native communities as well are all about, conversing with each other, storytelling, listening, understanding. And so it just has a new word to it. And I think if we can really understand that it's not this big new concept, this is something we're already doing with our communities, it'll make it a little bit easier. And so, again, it really just involves the parents or patients and the healthcare providers when you're considering vaccine benefits, vaccine risks, and risks of infection. And the Common Health Coalition, it's in our newsletter, and I think it's the link here that you can check out when you get the slides, but they created a guide for clinicians on how to kind of work through the shared clinical decision making. I did also want to just briefly touch on motivational interviewing. This is definitely probably bringing the changes that we've seen have probably brought a lot of concern to your community. And so navigating those conversations can be difficult. And motivational interviewing is a really good technique when you're trying to have those conversations, especially, having that reflective listening when you're doing it. And so this tool, I think Liz might be sharing this one in the chat with you all, but basically it's a one pager that kind of steps through how you can go through and use motivational interviewing strategies, something you can print and hang around the office for providers to look at. But it's definitely a good technique that kind of puts in perspective and for you as the provider or the person who's coming with the information and sharing and respecting the person that you're talking to and listening to their concerns and ensuring that they feel like they're being heard. And so I just wanted to share that resource as well with you all really quick. All right, and I'll actually hand it over to River, who's our social media expert. That is not me, who's going to talk a little bit about how to make social media work for your community.
Thank you. Expert is generous. There's definitely a team of us that make it all happen. But when it comes to social media, there's a few things that we've learned along the way, and that is that shorter and clearer storytelling typically works better, because most people are scrolling through their phones. So posts that focus on one message paired with strong visuals, they tend to reach further and get more engagement. And each platform works a little differently. They each have their own rhythm. We primarily use Facebook, Instagram, Twitter, and these different formats have different audiences, and making small adjustments for each of them can really improve how content performs without creating more work. And there's a lot of new features that have come out this year where you can cross-collaborate with different accounts as well across the platforms, which has been really cool. And it's also important, though, to remember that social media doesn't stand alone, at least in native spaces. Many of our community members still rely on clinics, local radio, and in-person spaces for information. So social media works best when it supports those trusted existing channels rather than trying to replace them. And consistency helps build trust when it comes to this, because the content, when it has a recognizable look and voice, people know right away where it's coming from, and the message feels more reliable. So that's why campaign-based storytelling, like toolkits that we have here, our Be a Good Relative campaign, they're very powerful and they're very helpful. They reduce staff strain and they provide ready-to-use messaging. And it still allows room for you to customize for where you're based across the country. And our Be a Good Relative campaign here, available on our website with many more toolkits, is an example of how you can center, in this one, family, elders, future generations, and it frames health decisions as acts of responsibility instead of pressuring. And so with that in mind, I'll turn it back over to Alyssa, and we will learn more about some in-person insight.
Yeah, thank you, River. You do a great job on social media, so I appreciate you sharing kind of your tips and tricks to that. And I really agree with you. Those toolkits that are already ready to go just make it so much easier. So now we'll go ahead and transition and hear from Honey Rhonda about what they're doing at Urban Indian Center of Salt Lake, kind of get some real examples of how they're connecting with their community. So I will go ahead and hand it over to you.
Thank you so much, Alyssa. I appreciate it. And River, great points on social media as well as outreach. We utilize some of those same aspects when it comes to here at the Urban Indian Center getting the word out. So we'll go ahead and start with our slides. Welcome to the Urban Indian Center, of course, to each and every one of you. The main point of this presentation today is that we are building trust, wellness, but also vaccine confidence within our communities. And we're using all different parts of social media in person, but also the connection of our community through all of these instances. That way we're able to get the message across to the right individuals, which serves the better parts of our community. Go ahead and go to the next slide if you could. Here at the Urban Indian Center, we serve the people. As you have seen on that first slide, there is an acronym that we use, which is the people. It's very important to the mission, the vision, and the values that we provide here at the Urban Indian Center. And the main point of all of this information is that we understand that detailing all of this information, it provides the reason why our community trusts our messaging. So our mission here at the Urban Indian Center is to serve the people by honoring Native cultures, strengthening health and wellness programs, and cultivating community. Our vision here is we envision that all Native peoples living balanced, prosperous, and healthy lives in diverse communities for 7 generations. And our values here at the center fosters cultural identity through programs that celebrate tradition and heritage. So we value the people here at the center. And that's how we are living the vision, by serving the people and honoring each and every one of the traditions here in our communities. So here, our mission is telling us why we exist. Our vision is detailing what it is that we are working towards. And then our values are detailing how it is that we show up for our community. So that's exactly how we break down our mission, our vision, and our values when it is that we are working with all of our community members in whatever capacity that it may be. Go ahead and go to the next slide. Here in Salt Lake City, Utah, at the Urban Indian Center of Salt Lake, we have a big impact to the greater parts of the state. So I would like to acknowledge that we honor 8 different tribal nations here locally. We also honor and serve different counties in Utah, and there are 5 of which that we serve. So I have detailed them on the map. That way you can see where it is that we utilize our service line and how it is that we get that information across. So we serve the better parts of Utah, which is Salt Lake County, Utah County, Weber County, Davis, and Tooele County. We have 3 different locations here at the Urban Indian Center, all of which serve a different purpose for each of the different locations. So the location that I'm at right now is the Cultural Community Center here at the Urban Indian Center. And in Murray, Utah, we have our clinic, which serves all of the wellness opportunities for our community to come together. And then we also have an administration building. So those 3 different locations offer the different ways in which we can get to our community with the best ways of serving our community by being in person and available, as well as social media and online. Go ahead and go to that next slide. Perfect. The way that we strengthen our urban Indian communities. Of course, this is something that's very important for us. It details why we do the work that we do and why it's important to the work that we do for our community members. We serve our American Indian, Alaska Native communities that face historical and ongoing health inequities. There's a lot of mistrust that comes from the historical traumas in our communities that we're working really hard to make sure that we are mending those relationships through the work that we're providing. The populations that we do serve could be disconnected from tribal or culturally specific health messaging. And I think about that in the sense of the community that we serve, this Urban Indian Center, the location at which we are all in right now. It's a little bit unfamiliar to a lot of the community members that do come in from the reservations or outside of the city. And what we're trying to do is build that relationship, that repertoire with each and every one of our community members through the work that we're providing, but also that the messaging gets out and it's across all of the broader parts of our community. We're making sure that we are providing trusted, culturally relevant outreach opportunities with engagement and confidence in all of the vaccines, of course. Go ahead and go to our next slide. Perfect. So engaging our community with trust and culture. We are meeting our community where they are, and we're leading with culture. And it's been very, very important to the events that we've already provided, like one of which is Boo to the Flu, where we bring in our community members to have an opportunity to celebrate the time of which is for Halloween, but also offering that opportunity for vaccines to be available for community. It's sort of like a one-in shop where everybody comes together. You can have fun, but also get taken care of with your wellness. And what that does is build the relationship within our community with our providers, but also it makes it safe, it makes it fun, and it makes it so that they can forget that they got the vaccine right after, so that they can have fun with their family and their community and providing the resources through the different organizations that we do collaborate with. So not only is it a fun event, it is providing wellness to our community, keeping our community safe, but also building those relationships. There's another event that we do provide here at the center. It is our back to school fair, which does support and provide vaccines as well as different opportunities for wellness building, but also connecting the relationships within our community with our providers. Those two instances are very, very important for us. And what that does for us is we're able to meet the community, of course, where it is that they are, but also where we are in our community. The work that we do is very, very important because we are seeing the importance of wellness to each and every one of our community members, but also following through on all of the processes of making sure that we are seeing them to continue on with their wellness. We're leading by building relationships. We're not just providing information. So what does that look like? I'd say from an outsource looking in, it looks as though we're not just doing the work during business hours, but we're also going out in the community and being a part of all of the aspects, all of the community events, making sure we're shaking hands where it's meaningful, but also making sure that we are acknowledging our individuals in our community that we do serve in the proper way, in the ways in which our Native communities have always done, which is connecting, shaking hands, coming together for food, but also building those relationships through great communication. What also we are doing here at the center is providing a clear, culturally relevant messaging through building confidence. So not just in-person relationships that we're building, but we're also doing that on social media. We're also doing that with the radio station here locally. We have a local radio station that provides an opportunity for our Native community members to have a specific time set aside for them. So we utilize that time to try to get all of the messaging out that pertains to our community, our clinic, our cultural events and opportunities to make sure that that information is getting out. So radio wise, we utilize the verbiage that's very important to just getting the main points out, not having long conversations or long bullet points, such as River was stating when it comes to outreach. We're making sure that we're making the points clear, that we're getting to the right important point, and that we're making sure that it's fun and collected. It's early in the morning, so it's always a great time to remind our relatives, hey, get up, get a good stretch in, and get yourself taken care of. Another outlet that we utilize is through the different TV screens that we have in the different locations that we have. We're getting our messaging on those TV screens so that when the community is waiting for their appointments or waiting to be seen by a provider, that they're able to see that information that needs to be out there in the community. And it's provided by us here at the Urban Indian Center, that we are providing that messaging. And the messaging is very, very clear, but it's also very personal because the people that we do see and the people that we are connected with, they understand the verbiage that we're utilizing. So we're utilizing the same verbiage when it comes to our content that we're putting out in the community, that we're making sure that it is simple, it's easy, it's realistic, but it's also authentic. So hearing the way that I talk is the exact same way that we would hear some of the messaging that would happen on our social media sites, but also when we're doing outreach in the community. These are the type of instances at which that language is being held across all different platforms, and it's equal across all of these platforms. So just know the verbiage that we're utilizing is the same verbiage that we utilize on social media, and we're making sure that it is utilizing the same guidelines as the AAP. So we want to make sure that we are staying in conjunction with all of the things that are provided to support the community, but also finding different ways that we can go ahead and initiate those conversations. Go ahead and move to that next slide. Perfect. So the two events that I had mentioned a little bit earlier, these are the two that are very, very important here at the center. Now, don't get me wrong, we do have a lot of opportunities as well as events, classes that are happening here at the center, but the ones that are catering towards getting the community confident in vaccines are these two events that are listed here. And you can see by the photos that are provided there that it's a fun, engaging opportunity. It's family oriented, so families can come and get their vaccines together, but also that generational communication going from elders all the way down to youth. It's that encouragement. Hey, we want to stay safe. We want to keep our families safe. We want to keep our community safe, and all of these different aspects. So the main point of the Urban Indian Center is that we're providing the confidence, the messaging, but also getting the word across to all the different generations and making sure that the different generations are also supporting that through the family instances and gatherings. So these events and opportunities, there's no appointment needed. You just drop on in. Also, there's not a fee that's attached to it. We do take care of our registered clients here at the Urban Indian Center, and we're doing the best that we can to make sure that we are opening some of these outlets as well as these doors to cater to the families that are within our Native community members. Households, but also the communities that we serve. So just know that these two events are events that we hold annually here at the Urban Indian Center. This is something that we look forward to every single year, but also our community looks forward to these opportunities where they don't have to go into a clinic setting, that they can be in the community getting the support from everybody around them to encourage wellness for each and every one of the members. Go ahead and go to that next slide if you could. Beautiful, beautiful. So the learned lessons and the best practices here at the center is that we're bringing families together, we're strengthening relationships, and we're building trust through the culturally grounded opportunities that are here, but also that we're sending out and providing a trusted message, that we are those messengers that are getting out there. We're increasing comfort as well as participation while improving access to vaccines and supporting stronger, healthier urban Indian, Alaska Native communities. So we're prioritizing listening. And that's something that River had stated in his cute little outreach opportunities for social media. We're prioritizing listening. We are listening to what the community is saying. We are providing that opportunity for them to come in and feel comfortable getting their voice out and getting their voice heard. We are prioritizing listening. So we're understanding that community needs they adapt to the events as well as the messaging where we can meet people where they are. It's because of the community that we're able to utilize the proper messaging to help build that confidence. We engage all ages, just as I stated. We try to get the different generations involved in encouraging confidence, but also making sure that that support is provided by a multi-generational participation, strengthening the entire family that we're hopeful to see, but also hopeful to continue to support. We're collaborating with different partners. So what that means here at the center is we're finding different ways and finding different opportunities to get the word out. When we're collaborating with different members in our community, we want to make sure that we understand what messaging they're utilizing and how it is that we can cater it to our Native community members, utilizing the right verbiage that does cater to the wellness as well as the things that we as Native people have been experiencing through all of our lives. So we're making sure that we're collaborating with partners so that the same messaging is not getting across when it comes to the different organizations that are in collaboration with the Urban Indian Center. We want to make sure that the messaging is different. And that's something that I'm very, very proud of, is that we can be a little bit different. The messaging is very, very personal, but it's also very connected. The last one here is celebrating successes publicly. One thing that we've taken to initiation here at the Urban Indian Center for 2025 to 2026 is promoting and supporting and celebrating all of our community members. Now, you might think, what does that look like? We provide honoring events where we celebrate the achievements of all of the participants within any of the classes or opportunities. We provide certificates and whatnot. When it comes to the vaccine confidence, we provide like a UICSL teddy bear or something that gets them that encouragement to last a long time. So we're celebrating all of the milestones. We're celebrating the successes. We utilize social media in a proper way, of course, provided that we get all of the photo releases completed and here at the center, we are celebrating our community. And I think that's something that our community is not necessarily used to right off the bat. But as we're continuing to provide that support, but also to succeed publicly with our clients and our participants, that we're noticing that change in the confidence, that they trust us a lot more, that we are doing the things that we say that we will do, and we're getting it out there in a very good and meaningful way. So these are the ways that we are learning from the lessons, but also from the practices that we are utilizing here at the Urban Indian Center. Go ahead and go to that next slide if you could. Beautiful. These strong relationships and tribal partnerships. Here at the Urban Indian Center, we have been serving over 100 tribes. So yes, I did state that there are the 8 main tribes that we do serve here at the center. Yes, that is because this is ancestral homelands of those 8 tribes. This is their traditional homelands. But outside of those 8 tribes, we do serve other tribes and we do serve other communities. So all in all, we serve a vast amount of community members that represent all different tribes, all different locations, but all different agencies also. And what we do is try to build those partnerships, but also continue to establish new partnerships. So through these collaborations in the community, we're able to serve all of the Native American tribes here in our community, and we're able to support the wellness along the way as they continue on with their success. We're partnering directly with tribal leaders, so we do hold our tribal leaders meetings here at the Urban Indian Center, where we offer a platform for all of our tribal leaders to come together, that we can talk about hard decisions and deep discussions on how it is that we can gain and better improve confidence in our communities when it comes to this health aspect of vaccines, and how it is that we can get the word out a little bit more. We are collaborating with our tribal leaders, and we're making sure that their voices are heard within the community that we serve, but also that our voices are heard. So when they take it back to their communities, that they are better supported with a vast amount of different ways that they can go ahead and achieve those successes. So here at the center, we're providing the opportunity where we can hear the different voices of our community, but make sure that we're initiating that in a positive, very, very good way. And I say that in the sense because when we have community members that come from a different tribe and they're here locally, there's not necessarily like a landing point for every single tribe, but the Urban Indian Center is the one stop where all of us can come together and really support the wellness of our community collectively with the support and the strength of each other, but also providing that we are utilizing the confidence that we already have as an organization and pushing that to our community so that they trust the work that we're doing, but also the messaging that we're providing for each and every individual that we serve. Now, with the collaboration that comes in from the community, that strengthens the relationships here at the Urban Indian Center, but it also strengthens that trust that we have people that back the Urban Indian Center and support the Urban Indian Center, which does support our clients and our participants at the end of the day. So knowing that we have the collaboration within our community through the different tribes and the different organizations, that's just a stronger message to our community that the work that we do is very valuable and it's meaningful. Go ahead and go to that next slide. Here at the Urban Indian Center, these are just some, and it's a very small, vast amount of things that we're providing. One thing that I've started to understand is in order to get our community in the building a lot more, we need to better, I guess, better promote and better serve the clinical aspects into the community. So this is where some of the flyers that we do put out there, you can kind of see the messaging that we're utilizing. You'll notice that the color scheme is very, very near and dear to Urban Indian Center. We make sure that the messaging is relevant and that it caters to the community that we're looking for. When it comes to those messaging, we try to cater it to the specifics of the generations that we're working with. Our elder classes, the verbiage are utilizing the elder verbiage. When it comes to youth, we're utilizing the youth verbiage. When it comes to clinic, we're very specific in the information that we're getting out to the community. So I've just put a list of flyers that we utilize here at the Urban Indian Center, but I also put our social media platforms and our link as to which and where you can go to find us. Follow us. Go ahead and find the messaging that maybe fits best for you and your community. Utilize it in a very good way. We'd love to share that collaboration with you. And go ahead to go to the next slide. Beautiful. So this here is just our thanks to you. Thank you so much for having us. Again, we are here at the Urban Indian Center of Salt Lake in Salt Lake City, Utah, of course. And I am again honored to be the outreach manager here at the Urban Indian Center, providing the proper messaging to get the messaging out to our community that supports the confidence, the wellness, but also the community all in all through the work that we provide here. So give us a contact. I have the contact information that is listed there. And you can reach out via our website, email, or you can give us a call at any point in time. And we are here to assist, collaborate, and serve the people.
Thank you so much for that wonderful presentation. There was something you said around the outreach events that you host, like really connected with me. I feel like sometimes when we're talking to, especially non-tribal partners about, what are UIOs and what does it mean to do, healthcare in the community? I don't think they always connect to that. And I love what you said about through these events, they don't have to go to a clinic to practice wellness. They can practice the wellness in the community. And I think that really just ties that together. Um, I did see there was one question in the chat for you. It said, Rhonda, is the IHS directly involved or are they at a distance?
IHS is at a distance, but we do try to keep IHS involved as much as possible. Now, when it comes to the messaging, that's where I mean we're trying to keep them involved as much as possible, is making sure that we are reaching out, that we're connecting, that we're collaborating in the sense of asking questions and making sure that we are on the same page. But also, we do get the support from IHS. We do have the opportunity to reach out at any point in time to gain confidence here at the center, but also how it is that we can push that to the community. So yes, we do have support from IHS, and yes, they are at a distance, but at the same time, they're right at the forefront. They're meeting us where we are here at the Urban Indian Center.
All right. I'm going to go to the next slide, River. I just wanted to share really quickly another example of what the toolkits look like, kind of like what Rhonda and River talked about, but this is a toolkit that we launched this year for RSV. They're ready to use. There's messaging that you can pull from if you like. You can use your own, but Liz went ahead and dropped that in the chat for you. Next slide. I know we're running out of time. I had a couple things on here, so I'm thinking River, well, there's a question on here that you're welcome to answer on the polling, but if you also just have a question for myself, River, or for Honey Rhonda, feel free to also put it here, or you can come off mute or put it in the chat. I think we have time for maybe a couple questions before we wrap up. Otherwise, if you had any successful social media campaigns, outreach strategies, or events that you've implemented that you wanted to share with the group, feel free to put them on there. I did want to share really quickly in the chat our word cloud of how it kind of finished, and I think it connects really well with what has been talked about when it comes to outreach, which is that connection and trust. I think you should double to see the picture. All right, I'll just give it one more moment to see if there's anything that'll come through. But if not, you'll have our our contact info. Feel free to reach out. All right, I think we can go ahead and go to the next slide as well, Robert. So just a quick wrap up before we let you all go. We do offer one-on-one technical assistance to UIOs. So we'll put that link in the chat for you. If you have anything that you need support with, feel free to send a request our way. We have other events that are upcoming, so definitely take a look at our upcoming events link. And then our annual conference is also taking place in April, and registration is now open. So get that early registration discount. And then yes, we will send the slides either today or tomorrow. You'll receive a copy of the slides. All right. Feel free to subscribe to our newsletter. We talk about a lot more beyond just vaccine work, but policy, technical assistance, research. So definitely stay connected with us. All right. Again, thank you all for joining. Please, if you have a moment, fill out our survey. It really helps us know how we can improve our events, know what we're doing right. There's a link in the chat for you to click, and then you can also scan the QR code if you'd prefer to do that as well. I'll go ahead and put my email in the chat. Honey Rhonda, I don't know if you wanted to as well. I realize I didn't have it on the slide, so if you have any questions, feel free to reach out via email. And again, we will send a follow-up email with a copy of all the slides, so you have the links and information shared today.